right, welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and we have our monthly Q&A, question and answer episode. Of course, as always, my right-hand woman, Maria, the producer, is going to be asking your questions. I have to say that you guys are doing great. Historically, in the past, I would say that when you guys would send questions, and by past I meant maybe we started in 2019, 5 years ago, I don't think the questions, you'd send in, let's say, 100 questions and I'd pick 20 of them. So it was like 20% of them were useful. Now I think we just went through all of them and we're going to use all of them, which says a lot of things. Number one, it says that people are really beginning to understand a deeper understanding of plastic surgery, which is awesome.
They're more educated.
They're educated, and your questions are very appropriate. So, all right, Maria, let us get started. So, welcome from Miami, by the way, and I'm glad that your mom is doing better.
Thank you very much.
All right, fire away.
Okay, so we have this from Rochelle Rediman.
Rochelle Rediman, this is your question.
Fat grafting to face, lumps, hardening, etc. Please.
Okay, so fat grafting is a massive concept of its own, and it's been around for many, many years, but like a lot of things, it's just more popular now. So first of all, it's not new, okay? Second of all, we have what I would say large volume and small volume fat transfer. What do I mean by that? Fat transfer to the breast and the butt is large volume. Yeah. Fat transfer to the face is small volume. That makes a huge difference because the way we prep and prepare the fat matters. In general, the basics of fat transfer is I go somewhere, that's the donor site. I take that fat. How do I take it? Through liposuction. I prepare that fat in some manner, and there's 100 ways to prepare it, and then I re-inject it in areas that I want to add volume. That's the basic principle, okay? So when you want to inject to the face, the purpose is as we're aging, we become 40, then we become 50, then we become 60, we start to hollow out. In addition to sagging, loose skin, we also lose volume. We get hollow in certain areas. So we realize probably in the last 15, 20 years that in addition to just pulling, which we used to do, we now pull and fill in order to look more natural and more rejuvenated. So the issues that you run into with fat transfer to the face, now going to the question, was lumps, irregularities, and things of that nature. In the past, people being doctors, weren't as good at preparing and injecting the fat. So I take the fat out, and depending on how large the goblets or clumps of fat are, will determine how large they are when I inject them. So when you inject in the breast and or the butt, you can get away with larger clumps of fat. It's a huge area. But when you want to put it in the face, you can't get away with larger clumps of fat. So first thing is when your surgeon prepares that fat, we have a method of downsizing the fat, meaning we take it out from, let's say, the abdomen, and then we start to pass the fat and prep it by going back and forth through syringes and making the size of the fat cells smaller. So it should be injecting more of a puree than clumps. So surgeons who don't prep or don't know how to do it, they're going to inject more large clumps of fat. So that's the first reason you get irregularities, because you go in there and you inject and you just drop a big clump of fat somewhere. Imagine underneath your eyelid. Well, shit, that's going to show in 2 seconds. The second thing is the nature in which you inject it, right? So you can't just go in there and go plop, plop, plop. You don't just drop little, let's say little cobblestones. You need to put it in with a cannula and you need to be moving constantly when you inject. So more like asphalt. And you need to go high, low, side to side. So the two areas. And spreading, and you're putting very small amounts often, as opposed to large amounts infrequently, right? And so last thing is where you're injecting it. There's a lot more forgiveness. There's a lot more forgiveness in the cheek than there is under the eye. So one of the areas that people got into and get into trouble is under the eye and the tear trough. So in general, today with the advances of fat transfer, like we now know a lot more and whatnot, it really should be incredibly infrequent and uncommon. But it still happens because people don't know what they're doing.
But so how I go to a doctor now, I want to do this. what should I ask the doctor to make sure that they're doing the right procedure?
The problem is you can ask them, but they're not going to be forthright. Hey, do you make clumps? No, of course not. Hey, when you do it, do you prep well? Of course. So what's your rate of irregularities? Oh, I don't get any. So this is not one of those things that you can ask. Okay. Whereas with other things, like you can be like, who closes? I mean, technically they can lie, but that's a very straightforward question. But with fat transfer, it's you just want to go to reputable people. Like you just
see their results.
Yeah, you want to look at their results, of course, but fat transfer results are not very helpful either because you can't see a clump in a photo on the internet. You can only see a clump when I'm looking at you in overhead light. I'm like, Maria, what's that thing under your eye? So it's a very tricky thing to be able to decipher. So you can't really prep for it. You just got to go to good people.
That's with time, does it get better?
No. Once it's clumped, you're screwed.
It's clumped.
Yeah. Don't clump.
Don't clump.
Yeah.
That's not a good thing. Okay, this one is, does PRP work for under eyes? Does it work for hair growth?
PRP for, what was the two places that they asked?
For under eyes and hair growth.
Okay, so let's just talk about PRP for a second. Plasma-rich protein, I think is what it stands for. Essentially what it is you pull out people's blood, you draw their blood, you prep it, and you separate out this area of the blood, PRP. It's considered to be a very rich, like it's the enriched area of the blood. You're getting out the blood cells and you got this PRP pure stuff. And the truth is, no one really even knows what this stuff is, the gold. And basically what we've been doing for the last 10 years is starting to inject it in different places. Now, don't get me wrong, there's science behind it, but it's not that specific. So doctors and specialties like orthopedics and are now starting to inject PRP all over the place in hopes that within the PRP is this magic stuff that will make things heal, rejuvenate, whatnot. Now, there is some science to it, but it is very general. So know that. No one can tell you this is going to work. It's sort of like still very early stages. Now, some of the areas that doctors use them is under the eyes. What are you using it for? If you're using it to get rid of dark circles, never gonna work. We've had many episodes about dark circles. It ain't gonna work. Dark circles is super complex. It's pigment, it's shadowing, PRP is a surface. Imagine it as like a polish. It's not gonna do nothing under the eyes. So you shouldn't be using it under the eyes if your goal is to get rid of dark circles. If your goal is to resurface your skin, like with microneedling, there's been some data that says it helps make the skin a little shinier, better. But definitely it's not going to do anything more profound. In regards to hair loss, there is mixed science. If your hair loss is due to male pattern hair loss, like 90% of men who lose their hair, very little science it helps. But if your hair loss is a woman who is going through hormonal things, or you had anesthesia and you lost a little bit of hair and it's going to come back, but you want to super boost it, then there is some science that you inject the PRP into your scalp. I've done it. Very painful. And that it will supercharge your hair coming back. So all you need to know about PRP is it's kind of experimental. Not in a dangerous way, but like don't hold your breath and definitely don't spend thousands and thousands of dollars.
Yeah, the results are still not very...
Well, they just don't know where it does and doesn't work.
Yeah. Okay, the next one is from Robidoux Jacqueline.
Wait. Robidoux? Robidoux Jacqueline.
Jacqueline. Okay. I don't want to look like I had a facelift. What is the secret to a natural look?
So that is a very common question. So anyone who gets plastic surgery, I'm here for my nose. I'm here for my eyelids. I'm here for my breaststock. I'm here for my tummy tuck. Everyone says the following initial phrase. I'm here for my fill in the blank, and I want it to look natural. I've never had a patient come in here and be like, I want to get a nose job, and I want it to look fake. So facelifts are no different. Now, we think of facelifts more as looking fake because we have so many celebrity examples, right? Like, God rest her soul, Joan Rivers, or all these other people. And the key with looking natural in all genres is to find that line and stay behind it. So what do I mean by that? So let's take a facelift. If you don't do it, you look the way you do. If you pull, you're starting to look good. And you pull a little more, wow, that looks really good. And you pull a little bit more, that's looking a little weird. You pull a little more, that looks really weird. You pull more, Catwoman. So it's a dial, right? It's slightly more, bam, that's the best you look. Keep going, now I'm looking weird. So your surgeon needs to have a good understanding and sense of taste and realize that if the line is somewhere here, you will never get there, right? If you try to get to the line, you've gone over. So as a good surgeon, you always stop shy of the line.
But then they can go somewhere else and then do it somewhere else.
So the thing that prevents you from looking fake is for you to be over pulled. And then in addition, when you pull, when you remove the excess, the direction in which you move makes a big difference. So for example, if you look at my face and I start to pull my little bit of excess skin straight back, what do I look? It looks weird. Like my mouth is getting pulled.
Right.
But if I move it somewhat upwards and at an angle of 45 degrees, that looks more normal. Why? Because that's how I aged. I didn't age forward and backward. I aged down at 45 degrees. So when you rejuvenate, you want to do so in the direction that you aged. So one of the reasons why people look weird is they have this what's called a swept look. A swept look, which means something looks fully pulled. And the last reason is you've had too many, right? Like you've had like 4 nose jobs.
Like the wind tunnel look.
Yeah, you've had 4 nose jobs. There ain't nobody making you look natural. You've had 3 facelifts. I'm not talking about one at 50, one at 70, one at 90. I'm talking about one at 50, one at 53, and one at 54. You understand what I mean?
Yeah.
So, all right.
So that pacing it out probably will make it more natural.
Well, if your facelift at 47, 52 was done well, chances are within 15 years, you're still aging. Yeah. And you'll need someone to just ratchet it a little bit. Then you'll look really good. And chances are if you're a vivacious 80-year-old, as it is my mom, you'll want it ratchet a little bit. That's normal.
Right.
But so many times people get it done, then they go do it again, and then you're screwed.
They fall in the little trap.
Yeah.
Okay, this one is from DD74. Can you do a tummy tuck revision if the first time around it didn't come out well, specifically the belly button?
So revision surgery as a whole is very difficult. It's not just difficult because you're redoing something. It's difficult because the anatomy, the actual thing that you're operating on, is no longer the way it was before. Certain areas are more amicable to being revised. Obviously, it all depends on how jacked up it is the first time. But like breasts, for example, they're a little bit more forgiving. Abdomens, not as much. And while you always want to get it right the first time, things like noses and bellies, you want to get more right than, say, your breasts, if I had to say something. So I've done many revision abdominoplasties, unfortunately. And the one area that's very tricky to fix is the belly button, because someone cut open a hole and pulled your belly button out and set that for life. And if that belly button, 9 out of 10 times when people come in and like, I hate my tummy tuck, it's 2 main things. It's my belly button looks super weird and my scar is jacked up. It's too high, it's irregular, there's a fullness down there. It's something to do with those 2 main things, amongst others. Well, once the person cut the hole and brought your belly button out, they've set the size, right? In all these 20 years that I've been in practice, I've tried 100 different ways to somehow make that belly button smaller, and it's never turned out to be anything that I'm like, wow, that was a great solution. So unfortunately, refixing a belly button, fixing scars, no problem. Fixing belly buttons, very difficult to do.
Okay, so the next one comes from Regina.Fitch. Do texture implants need to be removed? I found out mine was recalled.
So
Regina Fitch.
Regina Fitch. Okay, so textured implants. Let's have the skinny on textured implants. So what are the various types of implants? So first thing you need to know is what's in the implant. So you have silicone, you have saline, okay? Then you need to know what is the shape of the implant. We have round and then we have shaped. And then lastly, you need to know what's the texture or the surface of the implant. We have smooth and we have texture. We have a few other elements like profile, whatever, but for the most part, those are things you need to know. Back in the day, we had smooth, the outside is smooth, and we had texturing. And the thoughts were, one of the main reasons why we had texturing was the idea was that the texturing perhaps would lower the rate of capsular contracture. The thing gets hard, my breast is rock hard, my left breast does hurt, it's up it. We thought that making the surface of it kind of like sandpaper would reduce that risk. We now have learned that it doesn't really make a difference. The second reason why texturing was useful is that when you picked a shaped or anatomical or teardropped breast implant, you needed that breast implant to stay where you put it, because that implant has a north, a south, an east, and a west. Like it has a shape. You can't just spin around, right? The top is the top. It can't be on the bottom. Well, how the hell do you make it not move? How do you make that implant not go around in circles?
I never thought of that.
Right. So you can't suture it, you'll rupture it. So the texturing allowed that implant to stick, kind of like Velcro, and stick in place. Okay? As of probably, I can't remember now, 4 years or something, there has been identified a super rare type of cancer. Now, it's not breast cancer, meaning cancer of the breast tissue. It's cancer of the capsule. And the capsule is the scar tissue that your body forms around any foreign device. That capsule is just an envelope. And there is a type, there are actually two, but the more common of the very uncommon cancers is ALCL, anaplastic large cell lymphoma. It's a type of lymphoma. It occurs within this capsule. The treatment is to remove the capsule, and for all intents and purposes, in most cases, it's curative. When they did the studies, they realized that the cancer was pretty much directly linked to patients who had textured implants.
Oh,
in other words,
that's why the recall.
Yes. In other words, in the world, over 70 years, let's say, I'm making up numbers, let's say there's 100 million women that have breast implants. I think there's like 1,500 or 2,000 or 3,000 cases of this ALCL globally over all these years. So it's not nothing, but it's relatively rare. Of those cases, the overwhelming preponderance was due to women who had a texture in. Now, mind you, there are hundreds of thousands, if not millions, of women with textured implants that have no problem. So as a result, texturing was removed off the market until they could figure out what the hell is going on. So today, if you came into an office anywhere in America, you can't get a textured implant. None of the manufacturers make it. So also with that went the shaped implants, right? Because you can't have a smooth shaped implant. That being said, it was not advised, nor is it advised, for women with textured. Now, I'm going to get to your question with her. Oh my God, I have textured implants. Holy shit, I got to run out and go remove them. You don't remove your implant, let's say, thousands of women when there's nothing wrong. How the hell do I know if I have ALCL? So it is almost always associated with swelling, redness, and other types of symptoms. So the recommendation was pay attention. Pay attention to your breast, be more vigilant. And if you've had your implants in for a very long time, you should probably go in, have them exchange, and take the capsule out and remove the capsule and reset everything with a smooth implant. Now, to answer your question, she said my implants were recalled. So these implants were not recalled. They were no longer manufactured. There was an implant that was recalled, and that implant was a PIP implant. I just took one out a month ago. That was a French implant that was noted to rupture all the time, and the silicone was like industrial grade. It was a huge disaster. Those implants, if you have it, you open it, I'm like, holy shit, I have a PIP implant. You should take that out. So texturing and recall, and it's just a mishmash of words. But if you have a standard garden variety textured implant and your breasts are awesome and you have no problems, I don't think you need to run out and just remove them for the hell of it.
Okay, we're gonna come back. I have a couple more questions on rhinoplasty and fillers for labiaplasty.
Fillers for labia? No, I'm just kidding. Fillers for labiaplasty. That's right. You better want to.
That fillers was for my reaction.
Yeah, you're like, who the? Yes, fillers for labiaplasty. You're going to want to check out the second half of this amazing episode. We'll be right back with Plastic Surgery Uncensored. All right, welcome to the second half of Plastic Surgery Uncensored Q&A session with Maria, my producer. You guys have been doing great. These questions are fantastic. So Maria, don't go straight to the labia one. Save that for the end so people have to listen to the end. Okay, what's the question? What do you got?
Okay, what's the difference? This is from Ellie Design.
Ellie Design, here's your question.
What's the difference between tip plasty versus rhinoplasty? Is tip plasty meant for bulbous nose?
So the question was, what's the distinction between tip plasty and rhinoplasty, and is a tip plasty designed for a bulbous nose? So tip plasty is just a part of a rhinoplasty. So people, let me back up. A lot of the terms that we use in plastic surgery are used not amongst other doctors, but are used for marketing. Right? We create up these terms so that you, the layperson, can Google it and read it. But the reality is that's not what we would be talking about. And the reason why I say that is a rhinoplasty means rearranging the nose so it looks good. And within a rhinoplasty, let's say on average, there's probably 30 different maneuvers. You can bring the bridge down, you can narrow the bones, you can take the nostrils in, you can make the tip lower, higher, make the tip smaller, make the bridge taller. There's all these maneuvers, right? Of those, say 30 maneuvers, a handful of those are designed, or they're directed towards working on the tip. So in the super rare instance that someone walks into my office, their nose is perfect. Bridge, width, this, but their only issue is their tip, then my rhinoplasty will only be dealing with the tip. And if I wanted to market that, I could say, hey, you're getting a tip plasty. The reason the tip plasty is a word that we use is because it makes patients feel like their nose job is lesser. Yeah. I didn't get a nose job, everybody. Well, what the hell did you do? I got a tip plasty. You got a tip plasty? What the fuck? What the hell is a tip plasty? It's not a whole nose job. Yeah. So it's just nonsense. And the reason I say that is in the hundreds and thousands that I've done, I don't remember the last time that someone walked in with the most spectacular nose minus their tip. The second thing is that patients think that all they need is a tip plasty. And the thing is, how can I help you? Oh, I love my nose, except for my tip. I don't want to touch anything else, just my tip. That's not how this works. Yeah. Because your nose, your tip is connected to your bridge, which is connected to your nostrils, there is no way to move this lever without changing those other levers. So it's all an intertwining of your watch. You cannot affect one part without affecting the other. So 99% of the patients who are asking for tip plasties need other stuff done. It doesn't need to be dramatic. You don't need to be unrecognizable, but you can't just like isolate the tip and not touch anything else and then think it's going to look harmonious. It just doesn't work that way.
Yeah. Okay, so this next question comes from Shania Nay 92.
Shania Nay 92.
Can a lip lift be done at the same time as a nose job, or better to do them separately?
It's a great question. So that's a little controversial. So let's start with what it is. A lip lift is a facelift of your upper lip. What that means is that, by the way, this whole lip lift phenomenon, again, all due to social media, lip lifts have been around for 70 years. A lip lift was designed probably in the 60s and 70s. All it is going on the undersurface of your nose, on your upper lip, taking out a wedge, hiding that incision in the sill of the nostrils, and when you remove that wedge, it lifts the upper lip, therefore giving your upper lip a facelift. Why would you do that? Because as we age, just like our neck and our breast and our earlobes, your upper lip lengthens and your upper lip slowly disappears. Where the hell did it go? When I look at my 20-year-old pictures, I had such full lips. Now I look like I have two little pencils on my lips. What happened? You lost volume, and you have extra upper lip skin, and your upper lip rolled inside to your mouth. Rather than your upper lip looking like a ski slope, meaning nice and full, your upper lip is now a parabolic convexity, and it rolls inwards and down. It's a very powerful, very effective surgery. In exchange, you have a little scar underneath your nose, and if it's done well, maybe it's a good trade-off. Now, the reason why I say it's controversial, the reason why I say it's popular is because now 20-year-olds are getting it. It was designed for an older woman or an older gentleman. Now it's like, I'm on Instagram.
They want the Angelina Jolie lips.
Yeah, the other thing is I'm tired of getting filler, and so I want to do a lip lift. Well, now you look like you have a cleft lip. Like your lip looks almost like it's sewn to your lower nose. Anyways, we digress. So the concern is that when you do a rhinoplasty and you do a lip lift, they are intimately same borders. You're at the border of Russia and Iran. In other words, your nose, we're cutting here often, and your lip, we're cutting here. So there is some concern that the blood supply to the stuff in between will be a little compromised. Therefore, some surgeons recommend separating them. That tends to be my general philosophy. And some do them simultaneously. That's a per surgeon preference. And so you're going to have to talk to the surgeon about it. But it definitely is an area that people are a little, I don't know, I should maybe take my time, maybe separate them. I tend to separate them myself.
Yeah, I probably would not want to do both together. Okay. P Money 61 wants to know, is it possible to get filler in labia area for a little more fullness? If so, what type of filler is safe down there?
All right. So who is the person? P Money?
P Money 61.
P Money 61. Okay. So
she's probably 2 years older than me. 61.
How do you know it's a she?
But who? It has to be a woman.
Maybe it's a guy asking for his girlfriend or his wife.
Okay, that's true.
P Money. All right. So the first thing you're I think a decent number of people are like, what late? Why? What?
Exactly.
So
that's what I thought too.
Yeah, I know. Well, and then you said, well, I guess I haven't looked down there to know. So based on our whole dialogue today, what happens to your labia when you get older?
Hanks?
Same thing that happens with your earlobes and your breast and your upper lip and your neck. As you get older, you lose volume and you get extra skin. That's what happens to every part of your body. Your upper eyelids, your everywhere. Some areas, it's more volume loss than it is skin. Some areas, it's reversed. And most areas, it's a combination of things. So your inner labia, the labia minore, the labia parts that are thin and more floppy, those labias tend to get longer and they tend to be asymmetric, and treatment for that is a labioplasty. We remove the redundancy, hence creating a cleaner outer surface. Okay? That's not what this person's referring to. They're referring to the labia majore, which is the outer labia. Mm-hmm. Because as we age and we change our hormones, the outer labia lose fullness and become flat and deflated. And so a youthful labia has a short inner labia and a full outer labia. Okay? Mm-hmm. And so naturally the question is, if I lose volume in my outer labia and I don't like the way that looks, what can I do? And you could replenish the volume. There are two ways to replenish the volume in your labia. A, fillers. B, fat. And they're identical to your lips. Ironically, they're both called labia, lips. Mm-hmm. So what you would do is you would fill it with some source of volume. Now, fat transfer tends to be surgical. You have to, it's something that you would often do under anesthesia or local, whatever. Filler is you walk in, you open up a syringe and do it. So the filler I always and only recommend in general, just ubiquitously, is hyaluronic acid-based fillers. HA. Why? Because hyaluronic acid-based fillers are A, reversible, B, absorbable, C, no reaction because we have it and therefore you don't need to get tested. I don't see any reason for you to start using other items that have a longevity in this when you don't know if that product will go away. What if you occlude a vessel? What if you occlude a vessel and it's an emergency? You can't reverse it till it goes away and maybe takes 5 years or never. So to answer her question, if you're going to use filler, you should use HA. And within HA, we have various thicknesses of filler. So imagine thin paint, moderate paint, and thick paint. And you want to use thin paint in areas that are delicate, under your eyelids, in your nose. You want to use medium and thicker in places that have a lot of space, your cheeks, your jawline. And I think the medium ones are appropriate for the labia because it's really a sizable area and you need some cushion. So that's why people do filler to the labia. There, now you're gonna go home.
I never thought of it.
You're gonna grab a mirror. I know.
No, I'm not gonna do that.
Your husband will grab a mirror.
I'll just ask him, "Am I okay there?"
Your husband will tell you you're okay.
Yeah.
Period.
Yeah. No. Sometimes he does. Sometimes he doesn't. Okay, I want to mention some reviews that we've gotten that I thought.
I don't want to hear any bad reviews.
No, you're not going to get any bad reviews. But I have here refreshingly honest. I've been listening to Dr. Rahban's podcast for a while now and have been meaning to write a review. Dr. Rahban has a down-to-earth conversational style that is easy to understand and entertaining to follow. I truly enjoy his insights and eye-opening information.
Is that from my mom?
No, it's a long one. And let me see, this other one is from Top Notch. Very informative and unbiased. Some of these should be required listening before major elective cosmetic surgery. Let me tell you, every time that I have a friend who knows that I do the podcast, asks me, and I go, listen to the podcast. If you want to know, you'll hear from him, the horse's mouth. So, yeah, thank you for telling us on the patient side, the realistic outcomes versus the blurred, perfect images we see.
I appreciate that. At the end of the day, the purpose, it's Sunday. Maria flew in from Miami. Me and my whole team are here on a Sunday. And the only reason we do this is because we want to share this information with the listener in hopes that the listener will take this information, convert it into knowledge, and from that knowledge, make the right choice for them without being misled or confused or manipulated. So when I read these reviews, it's very heartwarming, and more importantly, it's reaffirming that, you know what, getting here, coming here, leaving my kids, you leaving your home is well worth it. So thank you for the reviews. So that wraps up yet another episode of Plastic Surgery Uncensored. I always end every episode with 2 requests. One is, if you find this information, as these reviews have written, informative and helpful and educational, share it with your friends and family. You have no idea who is considering or contemplating surgery till it's too late. They'll show up one day and they'll have had a complication. You'll be like, why didn't you tell me? So just share it. Just say, hey, check out this podcast. It's super cool. Secondly, if you do enjoy the podcast, we love to hear back from you. Write something nice. Right now, get off the podcast, go write something nice. Takes 2 seconds. And what it does is it helps us know that this is helpful. And 2, it helps the podcast elevate in its ranking. And the goal is for this information to get to more people. So we love you and we appreciate it. And that's a wrap for this week's episode of Plastic Surgery Uncensored. Until next week, I'm your host, Dr. Rady Rahban.